Hello everyone, welcome back to my YouTube channel Nursing Infinity, your learning partner. How are you all? I hope you people are doing good. So today we will discuss a new topic. Before starting, I want to ask something, a question. Have you think that how our body works perfectly in a so organized manner from a tiny cells to a complex body system like hearts, brain, etc. Complex. Did you people know? Don't worry if you don't know means I will clarify. In today's video, I will make this topic super simple and easy to understand for all the nursing students. Okay, so today we are going to cover some topics. I will list out. First one, organization of the human body. Next we can discuss levels of organizations. Third one, basic anatomical terminology. Okay, so these three criteria we will discuss today. So let's start. First we are going to discuss organization of human body. First let's understand how our human body organized. Okay, we can write the human body is arranged in different levels from simple to most complex. Okay, so there are some levels. That levels we will discuss one by one. First we can discuss chemical level. In that we can write this is the most basic level. It is the most basic level. First point we can write. Second point, it includes atoms and molecules like we know that oxygen, carbons and water, etc. Okay, so this is chemical level. Next we can discuss cellular level. Second one, In that we can write cells are the basic unit of life. Okay, for example we can write nervous cell, muscle cell, etc. Next, coming to third, that is tissue level. Tissue level. In that we can write group of similar cells forms tissues. Okay, remember that similar cells only, group of similar cells forms tissues. Okay, these are 4 types. These tissues are 4 types. One by one we can write. First one, epithelial. Next one, connective, muscle, and nervous. These all are 4 types of tissues. Next, fourth is organ level. In that we can write different tissues combined to form organs. Okay, example like heart, then lungs, etc. Okay, next we will go for fifth one, that is system level. In system level we can write organs works together to form system. Example like digestive system, then nervous system, respiratory system, cardiovascular system, etc. Okay, next and last one, that is organism system. All systems together forms a complete human body. Okay, complete human body. So These are the systems we have to follow. Levels, system, sorry, levels. These are the levels. One by one we will do revision. That one. First one is chemical level. In chemical level, what is that? These are the most basic level. This is basic level. It includes atoms, molecules like oxygen, carbon dioxide and water. Next one is cellular level. Cellular level. Cells are the most basic unit. We can say otherwise it is the functional and functional unit of the body also, we can say, like nerve cells, muscle cells, etc. Next, tissue level. Group of similar cells form tissue. Here you have to remember similar cells, not like different types of cell. Suppose I can draw here this type of cell, means another this type of cell only will be there, means it will attach together. This type of cell and this type of cell should not attach. Okay, this type of should not attach, but this type okay. So we are saying similar types of cells. Similar types of cells are attaching together, then only it will form tissue. These are 4 types of tissue are there. First one, epithelial tissue, connective tissue, muscle tissue and nervous tissue or nerve tissue. Then fourth one is organ level. Organ level, different types of tissues combined to form organs. Different types of tissues. Their cells, but here tissues. Different types of tissues are combined together and forms organ like heart, lungs, etc. Next one is systematic level or system level. Organs works together to form system. Organs work together to form system. Different type of organs are work together to form a system like digestive system, nervous system, respiratory system, then cardiovascular system, lymphatic system, integumentary system. So many systems are there. Okay, in physiology we will discuss that one. Next, 7th one is organism system, and the last one, all systems work together. All system work together to form a complete human body. All the systems are working together, then only our human body works. That is organism level or organism system. Okay, next, in easy way remembering, we can write, I will make you one flow chart. That one you can remember, or make a diagram and paste in your wall wherever you are studying and see that one, then it will be easily remember. Okay, here I will write flow chart. Okay, first is chemical level. Chemical, then it will go to cell or cellular, then it will form tissue, then organ. Next, organ will form system. System will form the organism. Okay, so this flow chart you can remember. Okay, first chemical, then cell, then tissue, then organ, then system, then organism. Okay, next, up to now everyone clear? No doubt? Okay, then we can go to next. Next we can discuss about next we can discuss about the positions or anatomical positions will be there. So that one we will discuss. Okay, so we can put heading positions. Positions. Already in nursing foundation also positions are there, but here anatomy also some positions are there. So first we can discuss supine position. Supine position. Supine position, the other name we can call it as other name, like that I can write other name. Other name is horizontal position, horizontal recumbent position, or dorsal position. All are same, but in exam they can write what is horizontal recombinant position or dorsal position. Then you have to think that this is supine position only. Understood everyone? Now we will write the definition. Lying horizontally on the back with the face and torso facing upwards. Facing upwards. Example known. We can write uses. Where we can use this supine position? Commonly we are using for sleeping. Normally we are sleeping, no? So that position only supine position. Or we can write examination, like abdomen, abdominal examination. Next we can write thorax examination. Thorax examination, etc. So here we can use. I will make some simple drawing. Means suppose this is one person. So this position is called as supine position. He is facing upwards. You can see he is facing upwards. So here, and his torso also upwards. So this position is called as supine position. Okay. Next position is prone position. Prone position, in that we can write a position in which the patient or the client, whatever you can write, is lying face downward on abdomen. Okay. Next we can write turn head in one side and rest on the pillow. Rest on the pillow. Okay, so this position, this drawing I will draw means, suppose this is one man, hand will be like this and his leg also like this. he will be, this is suppose line, in that he is sleeping. Okay, so this is only prone position. Okay, next is there upright position. Next position, upright position. Another name is sitting position. Sitting position. Normally we are sitting, no, that position only upright position. Okay, in that we can write patient seated on side of bed or examine table in straight position. Straight. Uses, I will show you pictures also, don't worry. Uses physical examination time. Physical examination. Next is to check vital signs, etc. In this time we can use the upright position. Okay, I am having pictures also. Once, see, this is upright position. You can see. Normally we can tell one person to sit normally, and we can see, we can check physical examination also, we can do vital signs also, we can do by this. And this prone position and supine position also I am having picture. I will show you, just a minute. See, here you can see supine position and prone position. See here, face, where is the face? Upside, up looking. Okay, and torso also upside. But here prone position, you can see the head is side and is sleeping on abdomen. Abdomen is downside. So this is prone position. Okay, upright position. And next, last one we will discuss, that one, lateral position. Or another name is sideline position. Lateral position or sideline position. In that we can write patient rest on either side of left, means left side lying means left lateral will come, and right side means right lateral. Understood what is lateral position? Uses we can say for rectal examination. And we can use for enema administration also. What happened this one? Just a minute. Rectal examination, that time also we can use that one. Okay, so here also, this one also I am having picture. I will show you, just a minute. See, this is right side sleeping, so right lateral position, and here you can see left side sleeping, so left lateral position we can say. Next page. Next we will discuss some terms, anatomical terms. Anatomical terms we will discuss. Actually, writing on paper and writing on one pad, that is full different, and I am not practiced, so it is making too much problem. I think day by day it will be okay, no problem, and you people will cooperate with me. I am thinking so. Okay, so back to my class. Now we will discuss some anatomical terms, important anatomical terms. Okay, one by one we will discuss. First one is superior, means above. Next one is inferior. Inferior means below. Next one is anterior. Anterior means front. Next one is posterior. Posterior means back. Next one is medial. Towards midline. Next is lateral. Away from midline. Next is proximal. And last one is distal. Proximal means near to origin. And this distal means far from origin. Okay, so this is the anatomical terms you have to remember. Another also so many anatomical terms is there, like I can say, see here, if you want to remember, so many anatomical terms are there. Here if I will say, here see, abduction. Abduction means your hand will go upside. Adduction means your hand coming downside. Here flexion means your hand will go upside. Here all arrows are there, you can see extension, forward rotation and backward rotation. And depression means your the shoulders will go down. Elevation means go upside. Then flexion means your leg flexion, leg extension. Then plantar flexion, plantar extension. Then here also you can see abduction, adduction, flexion, all are there. Here extension, flexion, all is there. Okay, so this photo wise, you once you do, then you will remember this anatomical terms. Okay, these all will be there. Just take one screenshot and you can practice. Okay, next we will go. Actually time is going on, I have to finish anatomy fast by fast, that's why, because so many is there, so we have to go fast. Next we will discuss for plans. PLANES, plans. So many plans are there. First one is sagittal plane. Sagittal plane. Sagittal plane, it means, suppose we are divide body, means human body, into right and left. How we will divide? If we are dividing middle onwards, we will divide our body into left and right. This one we will call as sagittal plane. If I will show you picture, means Okay, first I will write all, then I will show you one picture, then it will be easy for you. Next one is transverse. Transverse plane. Transverse plane. In that we can write a horizontal plane that divides the body into superior and inferior This is transverse plane. Next is third one is coronal plane. Coronal plane. What is coronal plane? Divides the body into front and back. Front means anterior and back means posterior. Okay, so this is three type of planes. First one is sagittal plane, transverse plane and coronal plane. Now I will show you one picture. In this picture you can see this. If I will divide into transverse means this one, upside superior position means upside position and downside position means superior inferior, that one. If I will divide into frontal and frontal means coronal plane, then you can see this is anterior side and that is posterior side, back side one posterior, front side one anterior. And here sagittal plane means if we are divided into two, right side left side, that one sagittal plane. And one more is there, that one I will write fourth one, that is fourth one is oblique plane. Oblique plane. In this oblique plane we can write it is a slants, sorry, spelling mistake, SLANTED, slanted plane between the horizontal and vertical planes. I think you didn't understand, but I will show you picture means you can remember. Photo not coming. If you see this, okay, I will draw. Suppose a human body. This human body, if we divide it into like oblique, we can divide this side one and this side one. If we cut it like this, suppose, then it will called is as oblique plane. Okay, this is called is an oblique plane. We can do this side also, we can do next side also, means like this. then this side will be 1 and this side will be 1. Which side you will do, no problem, but it is like oblique. Okay, this is oblique plane. So how many planes we discussed? First one, we will do one short revision. Sagittal plane divided our body into right and left, and transverse plane means horizontal and vertical, we will divide. Okay, so that one means it will go for superior anterior, you can see superior anterior. Then coronal plane means anterior posterior, this is anterior, backside posterior will come. Means suppose this side 1, that side 1, suppose we divide it like this, means this side 1 will come, that side 1 will come. Okay, and oblique means in one side, upside to downside, one like corner wise we will cut, means we can, that is called as oblique plane. Okay, so I hope you people understood up to now. Next class we will discuss another topic. So till now, if you people found this video helpful, don't forget to like, share and subscribe. If you like this video or any addition or any improvement you want, means comment below. Okay, so thank you all, goodbye.